This presentation is for practice supervisors and practice assessors as part of their preparation package. The aim of this short session is to go over some of the areas that you need to consider when carrying out practice assessment. There are three types of practice assessment. You will probably be very familiar with what we call summative assessment, and that takes place at the completion of the programme or the placement that the student is in. And generally, students are assessed against criteria. In practice, though, there are some issues around summative assessment being biased, and we will discuss this later on in the package. Diagnostic assessment happens at the beginning of a placement, and as a practice assessor and supervisor, you may well be making judgments about how you feel that the student is, if you like, proficient or not at certain skills in that setting. Particularly in the first couple of weeks of a placement, the student undergoes, if you like, a series of observations by assessors that enables you to set clear objectives and outcomes with them. Formative assessments are usually informative and inform the progress of the student throughout the placement. And formative assessments are usually designed to motivate, and you can carry out, if you like, informal formative assessments of the students and give them feedback on how they're doing throughout the placement. In order to assess the competence of a student, you need to be able to provide evidence of your decisions. This would include notes taken during observations by you on that student or immediately after, questioning the student and having some conversation with them so that you can gain an understanding of how much knowledge that they have. The students' reflections on the assessment themselves, the students' reflections on how they're actually doing in the placement. You should have, as an assessor, feedback from others. This would involve colleagues, maybe service users or patients, and certainly other healthcare professionals. And you should have feedback from practice supervisors to inform your assessment decision. You should not be making assessment decisions on your own. Simulation and role play or rehearsal may also help you make a decision whether or not a student is proficient at a certain skill. And also how the student, if you like, completes care records or other types of records, for example, does referrals for patients, those type of things. Any documentation can form your view of whether or not a student is competent. Validity and reliability relates to factors that affect assessment. And inadequate feedback from colleagues and practice supervisors or service users really affect the validity and reliability of your assessment decision. This is where we said on the previous slide that you should not make an assessment decision without adequate supportive evidence, and that evidence will come from colleagues. Bias towards the student in the form of either unconscious bias, or we have here the halo and Hawthorne effect. You do need to consider whether or not you have unconscious biases. You won't necessarily be aware of these. You may choose to click on the headings here, halo, Hawthorne and unconscious bias, and view the videos that are embedded within this file. Insufficient opportunity to observe and assess certain skills will lead you to have a very unreliable assessment. If you have your practice supervisors recommending the student has achieved certain skills, then please consider the amount of evidence that they have provided to you in order to inform your final assessment decision. Sometimes inappropriate methods of assessment, or maybe you're not using enough methods of assessment in order to make that assessment decision. Assessors do not have a mutual understanding of the assessment criteria and standards. This is whereby that actually your colleagues and practice supervisors, you need to have a team think about what is an acceptable level of a student passing an assessment criteria. The student's own preparation and readiness for an assessment usually means that they'll have a certain amount of nerves, and for some students that may be a lot more than others. If you look at the Hawthorne effect, that is where you would, as a student, perform better if you were directly observed than any other time. That is why practice assessment is, if you like, performed over a length of time rather than just a one-off episode. It is a whole bunch of conclusions that you draw as a practice assessor of that student's performance. However, be aware that any preconceived ideas based on other students' performances may affect your decision whether or not to pass that student. Is that student safe and demonstrating skills at an appropriate level in order to pass them? For example, you may have had an excellent student that was completely outstanding in everything that they did, and then you have a student that is maybe average, but they are still safe and skilled at what they do. Uncertainty of documentation and completion requirements by practice assessors, you will end up relying on the student to inform you how to complete documentation, and this isn't really professionally acceptable. If you have any concerns about how to fill in the practice assessment documentation, please contact your link lecturers. And finally, your workload demand will impact greatly on the amount of time that you have towards being able to perform students' assessments. Therefore, the more evidence that you have as a practice assessor from your practice supervisors about that student is really, really key to a valid and reliable assessment. For nurses and nursing associate students, there is a BPAD online which you will need to register in order to complete the practice assessment documentation. And any registered health and social care professionals acting as a practice supervisor can also register. So if you are a registered nurse, register as a practice assessor. If you are a registered allied healthcare professional, register as a practice supervisor. The feedback from service users will also form your assessment decision, and regardless of the professional discipline in which you are assessing, every one of them has a form of service user feedback within the student's practice assessment documentation. For nursing students, we have 4 different types, and as a practice supervisor or a practice assessor, you need to identify the most appropriate service user patient in order to get that feedback from. The forms are identified according to what ones you think might be most suitable for that particular patient. For example, the one with the stars may well help you with children or young people, and they can draw on here and they can colour in the stars. Likewise, if you had somebody that had difficulty with communication, you might just choose to do the smiley faces. How do you recognise underperformance, and what are some of the reasons for underperformance? There are very, very many, and I'm not going to go into them in this presentation, but let's just say they do tend to be individual to the student and not necessarily the same for every single one. A lot of students do have other areas in their lives that are affecting their performance, and you may need to consider what these are and how they're impacting. If you think that a student is not achieving what they need to do, this needs to be identified as early as possible, and particularly by the midpoint interview. It is really, really important that you follow the assessment process. So, if you like, failing to identify the student early on, not giving them sufficient feedback in order to action plan and improve their performance is something that you want to avoid at every cost. Practice supervisors and practice assessors will identify the student, it is the joint responsibility of practice supervisors and practice assessors to support those students. Practice assessors will communicate with the academic assessor via the link lecturers. Generally, you will not go directly to the academic assessor to support a failing student. You will go to the link lecturers first. The link lecturers will support you to implement the action plans. You need to have an understanding of the process of supporting the student. And as we said before, with any assessment process, you need to have that evidence. If you are having any concerns about a student, doesn't matter how early on their placement, please start recording the evidence, especially with dates and times of things that happen. They may seem incidental to start with, and you may think, oh, that was just a one-off thing. But things start to happen and mount up, and then you reflect back and you think, actually, I've seen that happen before. But because you didn't write it down or record it anywhere, you then can't support your decisions with any evidence. Prepare for the students' reactions and impact on the team, because they may well be considerable, and the link lecturers again will support you with anything that needs to be done regarding the student's placement. I've already just discussed the action planning. It's completed by the student and practice supervisors, usually at the beginning of a placement, to identify what their objectives and targets will be for that placement and what proficiencies and competencies they need to complete. It's also used where practice supervisors and practice assessors have identified concerns over a student's performance. If you have concerns as a practice assessor, you will liaise with the link lecturer and you will work together to support the student and complete an action plan with the student. The practice assessors have the responsibility to monitor the action plans and the performance within them. And again, you have dates of reviews here, and usually if a student is on an action plan and there is a lot of concerns, this will be weekly. But again, you can request that the link lecturer is involved in all of these. Part of the standards for practice supervisors and practice assessors has a look at the issues of accountability and how accountable you are as a practice supervisor and practice assessor. Always patient safety and staff safety comes first. Professional codes of conduct must be adhered to, and every health worker has a duty of care. If you have concerns in practice about unsafe working practices, If the student has any concerns about staff working beyond their scope of practice, bullying and harassment, anything like this, the student can also use the trust policy in raising concerns. And as a practice supervisor and practice assessor, you need to be aware of your own trust policies in order to help the student if they need to speak out. As we've already discussed, there are support mechanisms for the students and yourself at these times. And obviously, if you're a practice supervisor, there will be practice assessors to support you. But if you are a practice assessor, there may well be other practice assessors in the area. We've already discussed the link lecturer. Please, if you do not know who your link lecturer is, please find out who they are. Organisations, employers and practice education teams to support you in the area. They may well be academic advisors that the student has that may well be acting as link lecturers. Please do not muddle the roles up between link lecturer and academic advisor though. Additional learning support teams and student support services are based in the university, and if the student has any needs other than those to do with practice, they can access these within the university. And the academic assessor is accessed via the link lecturer. Finally, there are some resources here to help you. The Brooks Practice Education site has the links to all of the documentations necessary as a practice assessor. The Nursing and Midwifery Council has standards for supervision and assessment, and there's also a link to the SouthPad LibGuides here that you can access the practice assessment document for nursing.